Good afternoon, everyone, and welcome to the CAQH Core Town Hall. Quick overview of today's agenda. We're going to start off with an overview of CAQH Core and then get into an industry landscape update. Then we'll get into our two spotlights of the presentation, an advanced explanation of our benefits advisory group, and then our infrastructure operating rule update. Core staff will then get into our current rule writing efforts in attachments and eligibility, and then we'll have a discussion about our rule maintenance and pilot initiatives. We'll close things out with a Q&A. Some logistics for today's presentation. You can access all the webinar materials in the handout section of the GoToWebinar menu. You can also download the presentation slides and the recording on our website. As a reminder, a copy of the slides and the recording will be emailed to all attendees and registrants in the next 1 to 2 business days. And feel free to circulate that email with anyone in your organization who might also be interested. If you have any technical problems as well, you can submit those in the questions panel on the GoToWebinar dashboard. So with that, I will turn things over to Erin Weber, CAQH Core Director.
Great, thanks Daphne, and thanks everyone for joining us today. I will be giving a quick update on Core for those of you that are newer to our initiative, and then an overview of some of the work that we have going on to date. So if we can go to the next slide, CAQH Core is an initiative of CAQH. We are a industry-led group of healthcare providers, plans, vendors, government entities, associations, standard-setting organizations that have come together to develop operating rules or business rules, which really sit on top of the administrative transactions in healthcare to create more consistency and greater interoperability in how that information is exchanged. We are governed by a multi-stakeholder board of directors, and we see our role not only to develop the operating rules through our subgroups and work groups with our participating organizations, but also to support the industry as they implement the operating rules. So we have a robust certification program. We do a lot of ROI measurement, and we do education and outreach with the industry at webinars and conferences like these. So next slide, please. This slide just gives you an overview of the operating rules that have been published to date. CAQH Core is the national operating rule authoring entity as designated by the Secretary of Health and Human Services. So some of our operating rules are federally mandated, so all HIPAA covered entities must implement and be in compliance with the rules that are in purple on this slide. But you can see our rules really touch all aspects of the healthcare revenue cycle, from the time a patient schedules an encounter to get that eligibility information, all the way through payment and reconciliation. So we have a lot of breadth and depth in our rules to date. Next slide. Of course, we would not be who we are today without our participating organizations. And this is just a sample of the industry participants who participate in our work group, serve as co-chairs of the work that we are doing, and really help guide the direction and scope of our work. If you're interested in becoming a Core participant, you can reach out to any of our staff or email core@caqh.org after the call today. Another key aspect of our work, which I mentioned before, is Core certification. So any organization that implements the operating rules and is exchanging those business transactions can become Core certified. You will go through a planning process, work with our certification testing vendor to complete a number of test scripts, and then you will become certified and you can demonstrate your conformance with the operating rule requirements. We also have a recertification program which launched this year. So organizations have to recertify their compliance with whichever sets of operating rules they are already certified in every 3 years. And that helps ensure that as organizations go through system updates and mergers and acquisitions and other changes across the industry, that there is still compliance with the operating rules. Next slide. I'm always excited to share this information with the industry. We've had a lot of activity since our last town hall, so really over the last quarter. We have 3 new participating organizations that we'd like to welcome to CAQH Core: Children's Healthcare of Atlanta, Metal Solutions, and ClaimMD. We also have awarded a number of new core certifications, including to Alight, Healthcare IP, ClaimMD, and we have had our first 2 organizations complete the recertification process, with about at least 40 or 50 more expected before the end of the year. So congratulations to AltCare and Horizon Blue Cross Blue Shield of New Jersey on that achievement. Again, we are happy to answer any questions about core certification, and our staff and our team is here to help organizations as they go through these processes. Next slide. You're going to hear a lot today about all of our rule development activities that are underway. It has been a very busy year for rule development at CAQH Core, and I hope at our next town hall we'll be able to share our plans for 2022 as we solidify those. They will probably be less rule development focused and more strategy and implementation focused, as we have, as you'll see, a lot of new requirements and rules coming down the pipeline. This gives you a little bit of a timeline of what we've achieved this year so far, and I'll go into detail on each of these work efforts in a minute. But we have attachment rules, both for prior authorization and claims, that have been drafted and are now being reviewed by the review work group. So CORE has a multi-staged voting and approval processes where there are different quorum requirements and participation and approval requirements at each level in the process. So subgroups will draft the rules, or a task group will update the rules, and then the review work group's responsibility is to review the work of those other groups, make sure that they have no concerns or issues, and they have a formal ballot. And then the rules move to the CAQH Core participant all core vote, where organizations that implement the rules review and vote on the rules. And finally, then the core board does a final approval. So we expect that those attachments rules for prior authorization and claims will be finalized in the first quarter of 2022. The review work group this year is also looking at updates to our infrastructure requirements, and I'll talk a little bit about that in more detail in a second. We also have updates to the Eligibility and Benefits Data Content Rule underway, and some work related to the No Surprises Act Advanced Explanation of Benefit Requirements. We also have a couple of rules that have ongoing maintenance requirements, including the uniform use of CARCs and RARCs rule, which is part of our EFT and ERA operating rules. And that group meets regularly throughout the year to maintain the core code combinations in alignment with the latest updates to the CARCs and the RARCs, which are denial and adjustment codes. Next slide. This is just a different view of the different groups that have been meeting over the year. Again, I want to highlight each of these groups is co-chaired by industry stakeholders, typically representing at least one provider, one health plan, and one vendor, if not more. And so these individuals, we are very grateful for their time and their leadership throughout these efforts. You can see in row 1, we are looking at our Eligibility and Benefits Task Group, which is adjourning this month. And they will be sharing their updates with the review work group. We have the attachments work, which I mentioned concluded earlier this year and is now under review by the review work group. And then the review work group, which just launched a couple weeks ago, that group is looking at eligibility and benefits, the attachments updates, and those infrastructure updates that I mentioned a minute ago. Next slide. In addition to our kind of typical rule development efforts, we do have a pilot and measurement initiative that is ongoing. And in fact, we have a webinar next month. I believe it's on October 14th, but don't hold me to that date. I'm sure Daphne will share it at the end of the call. We have been doing a lot of work over the past 2 years with the Cleveland Clinic and Prior Authorization Now to measure the impact of automation of prior authorization and the use of standards and operating rules. So we're really excited to share sort of the phase 2 results of that in the coming weeks. In addition, we have been looking at some quality measure reporting measurement, looking at the use of CPT2 codes potentially on claims, and what is the burden reduction by using the claim to share that information. And again, we have an advanced explanation of benefits advisory group underway, which my colleague Taha will talk about in a minute, looking at some of those requirements within the No Surprises Act, and of course the maintenance that's ongoing. Next slide. Quick federal update. I'm sure many of your organizations have been writing a lot of comment letters over the past couple months. It's been a busy time. In particular, I want to highlight the No Surprises Act, which is part of the Consolidated Appropriations Act. This is the purpose of this is protect consumers from surprise medical bills, and it has a specific section related to the sending of an advanced EOB to patients for scheduled services, so they can be aware of their financial responsibilities prior to the time of service. There's a few links here. CORE drafted a comment letter on this topic prior to CMS publishing a set of FAQs urging the Secretary to delay enforcement and really think about how we can use standards and operating rules to ensure that the industry is implementing these requirements in a consistent way. The HHS, Treasury, and Labor have released one interim final rule related to the No Surprises Act, although they expect to release at least 2 more over time. And that FAQ guidance gives a little bit more information around the timeframes and expectations for when this additional guidance and regulation will come out. If you haven't dug into it yet, I encourage you to do so. There are a lot of resources out there from a lot of our industry partners as well to quickly get up to speed on what's happening with these requirements. Additionally, we have our 2 federal advisory committees that work closely in our space, including the National Committee on Vital and Health Statistics. That subcommittee on standards held a listening session last month to hear more from the industry on healthcare standards development, adoption, and implementation. It was a really interesting discussion. CORE submitted a comment letter where we encouraged the subcommittee to really consider how to think through the convergence of current and emerging standards across the industry, what the role of operating rules can be to help the industry during this time of transition. And there's a link here and on our website to those comments. I would encourage you to go to NCVHS's website as well if you're interested. You can listen to the hearing as well as see the presentations from different industry groups on this topic. And the Health Information Technology Advisory Committee, which advises the National Coordinator for Health IT, is also meeting regularly to make recommendations related to standards and privacy and other topics in the health IT area that ONC oversees. And so they'll be meeting again next month. Next slide. With that, I'm going to turn it over to my colleague Taha, CORE Associate Director, to share some more detailed information about our Advanced Explanation of Benefits Advisory Group.
Thank you, Erin. So on the next slide, I'd like to kind of walk us through what CAQH CORE is working on in relationship to the advanced EOB requirements as part of the No Surprises Act. And just to level set, I'd like to provide an overview of the No Surprises Act. So in December 2020, the No Surprises Act was signed into law, as Erin mentioned earlier, part of the Consolidations Appropriate Act of 2021. And essentially, the No Surprises Act seeks to protect consumers from surprise medical bills and ensures transparency regarding in and out of network deductibles, out-of-pocket limitations, and other health plan and provider provisions, and really to enable those patient protections. So going into kind of the different components of the No Surprises Act, Section 111 of the Act enables consumer protections through requiring health plan requirements to deliver an advanced explanation of benefits for a scheduled services within a set time frame. And that advanced explanation of benefits, or advanced EOB, must provide patient transparency into 1, which providers are expected to provide treatment, 2, the expected costs of such estimates, such as provider charges, what the health plan's payment responsibility may be, and then what the patient's financial responsibility for the service should be. And then number 3, the advanced EOB also must contain the network status of the provider, and then 4, additional disclaimers as needed, such as if authorization may be required for the service, or this is just an estimate. Then Section 112 of the No Surprises Act really places requirements on healthcare providers. Providers must verify what type of coverage the patient is enrolled in and provide notification through what's called a good faith estimate of charges to the patient at least 3 days in advance of the service and no later than 1 day after scheduling the service. So, and that that is the overview of the advanced EOB kind of requirements and what CAH core is kind of focused on for rule development and guidance activities moving forward. And then on the next slide, I'm sure many organizations are really wondering about what these implementation timeframes may be for implementing requirements of the No Surprises Act. And last month, CMS released FAQ guidance on components of the No Surprises Act related to advanced EOB requirements. So in relationship to regulations addressing kind of the good faith component of the No Surprises Act, HHS indicated that they intend to publish regulations addressing scenarios where an individual who are not enrolled in a health plan, or for those who may not be seeking to have a claim submitted for a scheduled service. And for scenarios where an individual is enrolled in the health plan coverage, HHS indicated that they plan on deferring enforcement on this requirement until rulemaking is adopted, as compliance with implementing good faith estimates is not likely possible by January 1st, 2022. So now kind of moving and transitioning into guidance related to regulations addressing kind of the advanced EOB component. And I'll be walking through the workflows a little bit later so you can see the difference between the advanced EOB and possibly a good faith estimate. So in relationship to addressing advanced EOBs, HHS indicated that they do not plan on issuing regulation before January 1st, 2022, as they've indicated that compliance prior to this date is not likely possible. However, HHS has noted that they do intend to undertake comment-based rulemaking in the future, as they work to implement provisions of the advanced EOB. And as such, until rulemaking is finalized by HHS, they've stated that they plan to defer enforcement of the advanced EOB requirements. So, as regulators really work to evaluate, what are the best approaches for issuing regulations related to advanced EOBs, good faith estimates, CAQH core is really engaged and working with industry stakeholders to develop a consensus-based approach and guidance document that really provides recommendations on how to best leverage uniform frameworks and standards that exist to implement components of advanced EOBs, with really the intent to help inform regulators and the industry at large as they evaluate solutions as they are evaluating the regulation and components of their own. So on this next slide, I kind of like to dive deeper into exactly what are advanced EOBs and good faith estimates. So think of an advanced EOB similar to an explanation of benefit you receive today after you visit a doctor. However, the advanced EOB is an explanation of unexpected services or items that you will receive in the future. The advanced EOB really aims to ensure that a patient has transparency into a service before it's rendered. And the advanced EOB really should include 4 different things. First, the provider or facility network status, and if the provider is in network, the contracted rate for that service, and if it's out of network, a description of how a patient can find a contracted in network providers. Second, the advanced EOB should also include a good faith estimate of expected charges, including the plan's payment responsibility and also the patient's kind of cost sharing responsibility for the scheduled item or service. Fourth, disclaimers that the coverage is subject to, it could be medical management, or that the estimates are subject to change. And fourth and last, any other information that the health plan may deem appropriate to include that would benefit the patient. So on the next slide, I kind of like to walk through this visual that really illustrates what an advanced EOB workflow should look like. So starting at number 1, a patient schedules a healthcare service appointment with a provider, or a patient requests an estimate for a healthcare item or service from a provider. So moving to number 2, a provider then verifies a patient's insurance coverage with a health plan to determine patient eligibility and benefit information for a healthcare item or service. And if a patient isn't enrolled in a health plan, step number 2B would apply, where a provider must send an advanced EOB of expected charges. And if a patient is enrolled in a health plan, a provider would then transition to step number 3. And this is where a provider must send a good faith estimate of expected charges for a healthcare service, including procedure, billing, and or diagnostic codes to health plan at least 3 days in advance of the service and no later than 1 day after scheduling the service. And after a health plan receives that good faith estimate, step number 4A would apply, where the health plan must then send an advanced EOB electronically or via mail back to the member, depending on that member's preference. And optionally, looking at step number 4B, a health plan can also send a copy of the EOB to the provider. So as we look at kind of this workflow, CAQH Core is currently working with an advisory group to really address requirements of step number 3 of the workflow. And other components of this workflow may be revisited by CAQH Core in the future. So on the next slide, I'd like to now kind of focus on where, so I'll give a moment for the next slide to populate. So on slide 19, I'd like to kind of now focus on the work of the CAQH Core Advanced Advisory Group. So the group has been tasked to examine a variety of approaches that the industry could implement to support advanced EOB requirements. There are a variety of implementation approaches that could be considered with varying levels of development complexity and spectrums that support interoperability. So as you can see on this slide, there although proprietary formats and web portals may be easier to develop and implement kind of on the left-hand side on simple and low, these requirements are don't really support interoperability. However, on the right-hand slide, kind of looking at and leveraging standard-based approaches such as X12 and HL7, these kind of standards really help improve interoperability, but they may be a little bit more complex to implement. But I think there's one area that the industry can really align on is looking at the scope of data content that may be needed to support good faith estimates or advanced EOBs. What are the key pieces of data that should go on a good faith estimate and be returned on an advanced EOB? So no matter what the implementation approach is, data should be uniform and agnostic across all approaches. So looking at the next slide. So I mentioned quite a few times that CAQH Core is working with an advisory group to develop an industry guidance document on how the healthcare industry can meet advanced EOB requirements. So this advisory group is a multi-stakeholder group, and it consists of about 32 organizations that really represent a diverse cross-section of the industry. So the group is scoped to evaluate the various implementations I just discussed on the prior slide, and it's now tasked to develop consensus-based recommendations for how the industry should implement, connectivity protocols, different messaging standards, and the related data content needed to support provider-to-payer exchanges of good faith estimates. And in the future, the advisory group may tackle additional use cases for advanced EOB requirements, such as provider-to-payer aggregation of service estimates or health plan to provider advanced EOB exchange. So the other components of the workflow I went over. And further, looking in the future, Core may consider engaging in rule development processes to take on the recommendations that the advisory group comes up with and within that guidance document and develop those into operating rules. So looking at kind of what we're currently working on and what may come out in the future, with looking at the advanced EOB topic and good faith estimates, there's a lot of work that the industry, is needing guidance on, and CAQH core is kind of positioned and working with the industry and collaborating with other organizations out there that are working on this work to really drive industry consensus on best practices and approaches to tackle this topic. So I'd like to now move into the next slide and turn it over to back over to Erin to provide a spotlight on our infrastructure rule update.
Thanks, Taha. So as you'll see as a theme today, we have a lot going on at CAQH Core, and we're really going to be focusing on that work today. Many years ago, when Core was first formed and the first sets of operating rules were being developed, the infrastructure surrounding the transactions for those administrative processes wasn't really covered by the standards. So the expectations for when and how these transactions were exchanged didn't exist, resulting in a lot of inconsistency across the industry. So the core participants came together and developed what were initially called the infrastructure requirements to help create some consistency for the industry. So we're talking about things like system availability, response time, acknowledgements, consistent companion guide formats, connectivity. All of those types of requirements are what we call the infrastructure requirements. The infrastructure rules now for eligibility, claim status, and the ERA transaction are all federally mandated under HIPAA. And additionally, for all of the transactions addressed by the core operating rules, there is a companion infrastructure rule. Over the past couple years, obviously, the industry has made a lot of advances in technology and other spaces, and some of those infrastructure requirements, which are more or less consistent across the transactions, have really become kind of outdated and not necessarily meeting the goals of core, which is to help move the industry forward. So for example, the system availability requirement is 86% of the time systems have to be up and running and ready and capable of exchanging a transaction. That was a real challenge for some organizations back in 2008, 2010. But as the industry has advanced, that is a pretty easy bar to meet at this point in time. So based on feedback from the participants and feedback from the core board, we will be using some of the review work group's time this fall to consider updates to the existing core infrastructure requirements to align with these evolving business needs and technology. We actually sent out an infrastructure rule update survey to the core participating organizations at the end of August to get some initial feedback on the system availability and response time requirements. So for some rules, the response time is 1 day, 2 days, 3 days. Are those things that need to be updated to align better with where the industry is now? So next month, once we get those survey results back, the review work group participants will review the findings and agree on specific adjustments as kind of the first step in updating these requirements. The work group might consider adjustments to requirements beyond system availability and response time requirements as well. So stay tuned. If this is something you're interested in being involved in and having a voice in, we would encourage you to reach out to us. If you're a core participating organization, you're welcome to join the review work group and complete the survey. And we'll continue to keep industry updated on where this is heading through our quarterly town hall calls. Next slide. And I think this next slide really just gives you an overview of the requirements and the operating rules that we are talking about here. So we were really looking at these 8 infrastructure rules that are aligned with each of the business processes addressed by the core operating rules. So look forward to keeping you all updated on where the work moves forward from here. Now, I believe I'm turning it over to my colleague, Emily Tenek, to talk a little bit more about our latest drafts of the attachment operating rules.
Great, thanks, Erin. So as Erin mentioned, we'll transition to the core operating rules under development, and we'll kick things off with attachments. So when we refer to attachments, we're really talking about the exchange of patient-specific medical information or supplemental documentation to support an administrative healthcare transaction, in this case, focusing on prior authorization and claim submission. So attachments really serve then as that bridge between clinical or medical data and administrative data. And as many of you likely know, there are many ways of exchanging this attachments information and a variety of attachment standards that are available today. So really, given this variability, the attachments process continues to be highly manual and a considerable source of administrative burden for plans and providers. So CORE has worked for the past several years on addressing the issues surrounding attachments, and in July of 2020, launched an attachment subgroup. So this subgroup drafted requirements based on opportunity areas prioritized by the attachments advisory group. These draft requirements that we'll go over today were addressing the prior authorization attachments use case and the claims attachments use case, as mentioned. So both of these attachments requirements are currently under review by the joint review work group that Aaron just mentioned, that launched in August of 2021. So that group is reviewing and refining the attachments rules that are drafted, as well as those other in-progress initiatives, including the infrastructure update and the eligibility data content rule update that Taha will provide an overview of later on today. So of course, as we engage with this work, our team also continues to monitor potential publication of an attachments NPRM that the HHS Unified Agenda announced may be published in 2021. Next slide, please. So both sets of attachments requirements really target key issues in the attachments workflow, such as the unnecessary back and forth between providers and health plans once a provider or claim was submitted, manual follow-ups by providers to ensure attachments were received, and then that they were appropriately linked or reassociated with the original prior authorization or claim submission, and inconsistent use of those attachment standards throughout the industry. So to address these issues, the requirements first address attachments sent using both the EXFO 275 transaction and additional documentation without sending the EXFO 275 transaction. So this could include FHIR resources, HL7 CVAs, PDFs, and more. So by addressing both the X12 275 and non-X12 methods used throughout the industry to send attachments, to support those type of mandated administrative prior authorization and claims transactions, the draft requirements really support that convergence of clinical and administrative data. So both the claims and prior authorization attachments rule sets include an infrastructure rule. As Aaron mentioned, that's a key component of our core operating rules. It really establishes key infrastructure requirements, and we'll go through those on the next slide. And the rule sets also include data content rules that require things like specific codes or reference data to simplify the reassociation of a claim or prior authorization to an attachment. And finally, the requirements provide additional guidance for communicating data and processing errors, so really allowing for more specificity when providers adjust a submission due to errors. Next slide, please. Give a second to load. Okay. So again, these attachments rules build off the prior authorization and claims attachments operating rules. So specifically with the prior authorization rules, they were published in 2019, and the attachments prior authorization rules ensure, again, the infrastructure and the data content meet the business needs for the submission and reassociation of the attachments to the prior authorization, and ensure that they align with existing core prior authorization and connectivity rules. So they're really aiming to close the loop on that prior authorization workflow. So I'll highlight here again that both the X12275 and non-X12275 payload formats are supported by these rules. And as Aaron mentioned, in alignment with those existing core infrastructure rules, these draft attachments and claims prior infrastructure rule requirements will look very similar. So you see the payload acknowledgement response times for both batch and real time. You see the minimums for document sizes, amounts of data that must be supported and accepted, data error handling, system availability, connectivity, companion guide, flow and format requirements here. And again, these align seamlessly with the existing core rules. So as mentioned on the previous slide, the draft attachments prior authorization data content rule includes requirements for reassociation, consistent reference data between prior authorization requests and the associated attachments. Next slide, please. Still loading. Okay. So again, very similarly, the attachments, claims, operating rules build on the existing core claims operating rules, which were approved back in September of 2015. So the claims infrastructure rule requirements mirror those we just discussed with the prior authorization attachments infrastructure requirements, including that support for real-time batch response time, system availability, etc. In addition, there is one claim-specific infrastructure requirement that is for the multiple electronic attachments to support a single claim submission. And again, you'll hear a common theme here. The claims attachments data content requirements are in alignment with the prior authorization attachments data content requirements, with the addition of a requirement that health plans use appropriate links to request the most specific additional information from a provider when it's not there with the original claim submission. So again, all of these draft requirements ensure support for the infrastructure and the data content that improve the claims and prior authorization workflows. So really aiming to reduce that administrative burden for providers and plans and close up these automated workflows. And with that, I think I will hand things back over to Taha to continue with our discussion of current rule writing efforts. Over to you, Taha.
Thank you, Emily. So kind of moving to our next rule development effort, this is kind of focused on the eligibility and benefit data content rule. And then before I kind of dive in and talk about the work that we're doing in updating the rule, I thought I'd level set and provide everyone with the overview of the existing rule requirements. So essentially the current eligibility and benefit operating rules really work to enhance the exchange of eligibility information between health plans and providers through consistent infrastructure and data content requirements, and really focus in on that exchange of patient financial information. So now looking at the rule requirements themselves, first, the operating rule really requires health plans to support requests for benefit information at least 12 months into the past. Next, the rule requires the return of certain data elements in response to either a generic or explicit eligibility and benefit inquiry. And these include providing the name of a health plan providing coverage and patient financial information for a set of 51 core defined service type codes. And the patient financial information includes information such as coinsurance, copayment, base and remaining deductible amounts, and being able to differentiate amounts between in-network and out-of-network services. Further, existing operating rule requirements support patient identification by requiring the normalization of last names to aid with member search and matching when a health plan is really trying to locate benefit information. And when a member cannot be found or a health plan is not able to respond to a provider's eligibility inquiry, the rules require that organizations publish requirements that really define a standard way for error reporting to really help providers pinpoint where the problem may be on the initial request. And the last requirement I'd like to highlight really applies to vendors. And this rule requirement requires vendors to be able to detect, extract, and display all data elements that we have operating rules for. And this is really to ensure that providers are able to have access to adequate eligibility and benefit information. So on the next slide, so now I talked about the existing rule, which I just reviewed, and I'd like to note that this rule was the first rule that was published by CAQH Core, and this was nearly 15 years ago. Although this rule set has been updated over time, but I'd like to highlight, as industry needs have evolved over the last several years, we received a lot of requests from stakeholders requiring the need for more robust and enhanced information pertaining to eligibility, coverage, and benefit information. So as a result of this, in fall of 2020, CORE asked its membership to identify, what are some of the priority areas for rule development that can happen in 2021, and CORE participants identified improving eligibility and benefit processes as our top priority area. So kind of looking at this, we began thinking through our work on updating the eligibility and benefit operating rule. So in April of this year, CORE launched an eligibility and benefit task group to evaluate various opportunity areas identified by industry stakeholders that could benefit from an update. So over the course of the last several months, the task group has worked through a consensus-based process, and participants agreed to draft updated requirements on the 6 opportunity areas that you see on the slide. So the first opportunity area includes addressing the industry need to communicate benefit and information related to telemedicine. The second opportunity area relates to the expansion of the number of service type codes that require explicit inquiry. So, currently the current existing rule requires 51, so we are working to go beyond 51 and expanding that service type code list. Our third opportunity area looks at remaining coverage benefits. So this is related to requirements for communicating, the number of visits or services that may be left on the benefit. For example, the number of physical therapy sessions or speech therapy sessions left to really help inform a provider on what benefits what that coverage is remaining for a particular member. Number 4 looks at requirements for a health plan to respond to coverage and benefit information for a certain procedure code. So going a little bit deeper from service type codes and really narrowing into procedure specific eligibility inquiries. And then our last opportunity area, number 6, looks at the delivery of eligibility and benefit information related to membership and tiered benefit plans. So benefit design can be really complex, and we received lots of feedback from the industry on building out rule requirements to support the delivery of tiered benefit information. So currently the task group is in its final stages of reviewing and refining these updated rule requirements. And next steps will be for the task group to send our updated eligibility and benefit rule to the review work group for review, and kind of transitioning, and so a good segue and transition to the next slide. So we just talked about, all of our major rule development activities for 2021, prior authorization, attachment operating rules, claim attachment operating rules, the eligibility and benefit data content rule, and our infrastructure rule update. So, next steps for, as we frame these rules and have draft rules in place, next steps for these newer updated operating rules really include a review and refinement by the CAQH Core Review Work Group. This work group launched in August to begin its review of our draft attachment operating rule sets that Emily just reviewed, and really the scope of what the review work group is really to ensure uniformity and cohesion across prior authorization and claim use cases. So that work is underway, and upcoming activities for the review work group in the near future include review updates to the eligibility and benefits data content rule update that I just reviewed, and looking at what sort of key requirements that we could update for the existing core infrastructure operating rules. So as you can see on this slide, there are all the different rule sets that the review work group is tasked to review. And I'd like to really thank all our core participating organizations who've really engaged in our rule development process and activities this year, and we're looking forward to receiving feedback via the review work group on how we could further help improve and refine these rules. And if you're a core participating organization, we definitely would like you to participate in the review work group if you're not already. Feel free to reach out to us in case you're interested and would like to sign up. So with that, that concludes the review of kind of our major rule development activities for this year, and I'd like to transition the call and hand it off to Mariana Singh, a core associate, to talk about some of our rule maintenance activities and the pilot initiative. Over to you, Mariana.
Thanks, Taha. I'll now transition to talk about two of our ongoing initiatives, the CAQH core EFTIERA enrollment dataset maintenance and our PA pilot that Aaron referred to earlier. As a quick reminder, the CAQH core payment and remittance operating rules were published in 2014, support the healthcare industry's transition to electronic payment and remittance advice by addressing variances in the processes and data elements. The rule outlines maximum sets of standard data elements and the flow and format for electronic collection of those data elements, among other requirements. When the rules were published, participants in the core staff recognized the need for an ongoing maintenance of the core required maximum EFT and ERA enrollment datasets. So they established a policy and process to review those datasets on an ongoing basis. From 2014 to 2020, review of those datasets was conducted annually. During those years, limited in-scope submissions from industry were received, and no substantive adjustments were made to the datasets. While the maintenance goal of the datasets remains the same, to address emerging, new, or changing industry business needs, given the enrollment datasets have continued to meet industry needs over the past few years, core participants voted to transition to a rolling submission process where potentially adjustments to the datasets can be submitted at any point in time rather than just during the annual review windows. If there's a submission which calls for a substantive change, then the enrollment datasets, the task group can then convene to review whatever potential updates may arise. The updated process will still conserve industry resources to address the most pressing issues while enabling critical updates to the enrollment datasets as they arise. So that's our enrollment data updates as of now. If we can transition to the next slide, we can review the PA pilot initiative. So the PA pilot initiative began with the goal to partner with industry organizations to measure the impact of existing and new CAQH4 prior authorization operating rules and corresponding standards on organizations' efficiency metrics. So CAQH Core partnered with Cleveland Clinic and Prior Auth Now to observe the efficiencies that occurred from having the 278 standard implemented along with the CAQH Core operating rules and API technology. CAQH Core began observing efficiencies made to Cleveland Clinic's prior authorization approval process after Prior Auth Now solution was integrated into their practice management system, which went live in February of 2020. So PAN solution began with one national plan and then eventually incorporated 34 plans of multiple lines of business into their solution, which was a phased integrated process. So in phase one, Core observed Cleveland Clinic's workflow to observe initial improvements by understanding the workflows of technologies, staff improvements, and a staff satisfaction survey, which was due to the low volumes of prior authorizations during phase one through the integration. So Cleveland Clinic reported those observations and efficiencies on the first case study published in August of 2020, which is linked here for your viewing. We're now in phase two of the initiative, a deep dive of the case study where Core, Cleveland Clinic, and Prior Auth Now identified and analyzed prior authorizations submitted through Prior Auth Now compared to those submitted not through Prior Auth Now. These were analyzed via a cross-section comparison for prior authorizations occurring between June 2020 to February 2021. Details around the priority metrics reported by time and volume will be shared on the webinar scheduled for October 14th, as Aaron mentioned, and an issue brief that will be released shortly around the same time. So please stay tuned for promotions of that webinar, which will be coming out in the coming week. I'll pass it now to Daphne for some polling questions.
Thanks, Mariana. So I'm going to go ahead and launch this first poll. As Aaron mentioned, CAQH core is really governed by our participants and industry feedback. So all of your responses here are definitely valued as we think about what processes we'd like to prioritize in the coming year. So you can select all that apply. I'll go ahead and close the poll in 10-15 seconds. Alrighty. And if one polling question wasn't enough, we have a second polling question for you all. And regarding 2022 priorities, we just want to know if there's any additional topics you would like us to prioritize in 2022. In the end of webinar survey that will pop up on your screen once I close out the webinar, you can submit any other topics that might not appear on your screen. Alrighty. So with that, I will move us into our Q&A. We do have a couple of questions lined up already, but just want to remind you all that you can submit any questions in the questions bar in the lower right-hand corner of your screen. So the first question we have here is, apart from telemedicine-specific eligibility and benefit information, is CORE exploring other opportunities to tackle and address telemedicine? Erin, can I pass that off to you?
Sure, thanks, Daphne. We are exploring other areas in telemedicine, and really it's been a CAQH-wide effort, looking at also where within our solutions we should be incorporating telemedicine, particularly with the ProView solution. Within CORE, when we think about telemedicine, the two areas are areas that we've already discussed, working into eligibility, also within claims, and then also, and we'll be sharing this information down the road, we're hearing more and more about needs within patient data sharing as well. So we need to investigate that a bit more, but those are the primary areas that we're looking at today.
Thanks, Erin. And based on initial polling results from our first poll, it seems that patient data sharing is something that the folks on this call are also really interested in CORE pursuing and thinking about. So
and
another
Daphne,
question.
Daphne, before you go into that, I was looking at another question that was submitted about the Cures Act and the role of FHIR, and I think that all kind of played in together. So I guess what we would be interested in hearing from you all, whether it's a follow-up email to this or in comments in the work groups and such, is what role do you think operating rules or CORE should be playing within patient data sharing? I think historically we have focused more on that provider-payer exchange, but we are hearing it, I guess it sounds like today, we heard it in our participant priorities poll last month. So I'm curious to hear more, and to answer the question around the role of FHIR and standards moving forward. I think this is a really interesting time for the industry. I mentioned the meeting that NCVHS had last month where they talked about and asked industry stakeholders to submit comments and talk about how we can support the industry in this transitional phase between current and emerging standards. And one of the things we've been thinking about is how can we support a roadmap for the industry in terms of understanding where the current standards are, where things are headed, to help organizations prioritize their resources over the next few years. So more to come on that.
Thanks, Erin. And we're coming up on our hour together, so I'll move ahead to our upcoming education sessions and events. So on October 7th, we have part 2 of a webinar that we're hosting with NACHA. Part 1 is available on our website and focused on understanding healthcare payments. And this follow-up webinar is focused more on how operating rules can improve financials in the dental industry. As both Mariana and Erin mentioned, we're also hosting a webinar with Cleveland Clinic and Prior Auth Now on October 14th. More to come on both of those webinars in the coming weeks. If you're interested in getting involved in CAQH Core, please do not hesitate to reach out to any of the staff members or email us at core@caqh.org. All of these efforts that we've described today would not be possible without the participants who are guiding and developing our work. So with that, I want to thank you all for joining us. As I said, please don't hesitate to reach out to anyone on the team. We look forward to your questions and feedback. Have a good afternoon, everyone. And thanks again to all of our speakers today.